So, hello friends. Today we'll be starting about ECG axis interpretation. Now, this is very difficult topic. Now, see, we have studied P wave in our first lecture. Now we'll study axis deviation because it will be useful at a lot of play. When you have to differentiate MI with pulmonary embolism on ECG, in cases of pericarditis, it will help. It will also help in differentiating posterior fascicular block with anterior fascicular block. So in a lot of places it will be helpful. So I'll try to complete this axis deviation here only so that we don't get problems when we are reading these things on ECG. Okay. So now this is something written, but I'll tell you. Now this is your heart. If this is your heart, this is left atrium, this is right atrium, this is right ventricular, this is left ventricle. Now each and they all contains myocytes. I have taken out one myocyte. Now this myocyte has a depolarization plus direction. So it has depolarization plus direction. For example, the depolarization magnitude is X and its direction is I. So this will be the depolarization vector for this myocyte. Similarly, when we sum the we do the summation of depolarizing vector of all the myocytes, we get the depolarization of the heart. And normally the depolarization of the heart is downwards and towards the left side. Now there is something which is very important to understand. Theoretically, while calculating the depolarization vector or depolarization direction, we do not use left atrium or right atrium and also right ventricle because mainly the mass of heart is of the left ventricle. So right atrium, right ventricle, right atrium, left atrium and right ventricular is not used. Only left ventricle is used. Okay. So this is one point. Now, before going into the detailed part, we have to understand a very important diagram, and I will tell you how to make this diagram. Now, first make a circle. Okay. Then divide it into 4 quadrants. Now make 2 V's. 2 inverted V's. This is very important point you have done. Now, we know that there are 3 leads which are inferior leads. Lead 2, lead 3 and lead AVF. These are inferior leads. Okay. So this we know. Now, remember F means floor. So towards the floor, which is lead AVF. So this is AVF towards the floor. Okay. And F contains how much line? 1 and 2 lines. So this is lead 2. And what comes before 2? So this is lead 1. Now we have just known that inferior leads are 2, 3 AVF. So 2 and AVF are there. So just left is lead 3. Now this is left side. So this we'll call as lead AVL. This is right side. So we'll call it lead AVR. Now your diagram is made. Now whenever you will count angle from clockwise, and this one is taken as a 0 degree. Whenever you will clock angle from this side clockwise, it will be positive. Whenever you will clock angle from lead 1 anti-clockwise, it will be negative. So this lead 2 is around 6 plus 60 degree. Okay. If we add 30 degree to lead 2, we get lead AVF. So lead AVF is at plus 90 degree from the lead 1. If we add 30 degree to the lead AVF, we get lead 3. So lead 3 is plus 120 degree from the lead 1, and this is 180 degree. Now coming backward, if we subtract minus 30 from lead 1, we get AVL, that is minus 30 degree. And if we subtract minus 60 from AVL, we get minus 90 degrees Celsius. And similarly, this is minus 150 degree AVR. So now we know the angle of every lead. Now we have just read the normal axis of the heart is between minus 30 degree to 90 degree. So 90 is this, minus 30 is this. That means normal heart axis is between AVL and AVF. So normal heart axis is between AVL and AVF. So this can be asked. It is very, just we have read in first chapter, first part in P wave, the normal P wave depolation is between 0 to 70 degree. But the normal heart or the ventricular depolation is between minus 30 to plus 90. And at minus 30 we have AVL lead and plus 90 we have AVF lead. So the normal axis of the heart is between minus 30 to plus 90, or we can say it is from AVL to AVF. So this portion is normal axis of the heart. This portion is the normal axis of the heart. And from AVF till 180 degrees Celsius, this portion is right axis deviation. This portion is right axis deviation. And from AVL, that is minus 30 to minus 90, we have left axis deviation. And from minus 90 to 180, we have northwest axis. This axis is known as northwest axis, or also known as extreme axis. So once you know this, we can read these. Cardiac axis represent the sum of depolation vector generated by individual cardiac myocytes. Clinically, it is reflected by ventricular axis, and interpretation lie on determining the relationship between the QRS axis and the limb lead. This we'll see in a short way. Since the left ventricle makes up most of the heart muscle, under normal circumstances, normal cardiac axis is directed downwards and slightly to the left. Normal axis is between minus 30 and 1 plus 90, also between AVL and AVF. Abnormal axis deviation indicates underlying pathology is demonstrated by left axis, QRS axis less than minus 30. So between minus 30 and minus 90, we have left axis deviation. Right axis deviation, QRS axis greater than plus 90. So plus 90 to 180, we have a right axis deviation, and extreme axis deviation between minus 90 and 180. Between minus 90 and 180, this is extreme axis, which is also called as a northwest axis. Now, the same thing is depicted here. This is inferior lead AVF. Now this is lead 2, this is lead 3. Inferior lead, this is lead 1, AVL, okay, and AVR. This portion from minus 30 to plus 90, or between AVL and AVF, is normal axis. From minus 90 to 180, this is the right axis deviation. And between minus 90 to 180, this is extreme axis, or also known as a northwest axis, that we will read in a short. And between minus 30 to the 90, we have a left axis deviation. Okay. So one thing that is very much clear from this diagram, this quadrant belongs to right axis deviation, this quadrant belongs to the extreme axis deviation, this quadrant belongs to normal axis, but this quadrant, it has a normal axis plus left axis. So you have to keep this in mind, because after some time this concept will be used, that this is a very different kind of what? This is a very different kind of quadrant, because it has a normal axis part plus it has a left axis deviation. That's why when we'll be understanding the different methods of calculating axis deviation, this concept will come into the play. Now, we'll use three lead method to understand. Now, for understanding three lead method, you have to understand first thing, that you have to understand two things. First thing is R minus S calculation. What is R minus S? Example, if this is your ECG, then this is your ECG, and then this is your ECG. So if this is your baseline, so maximum amplitude of QRS above the baseline is taken as R, and the maximum depth of the QRS below the baseline is taken as S. We calculate R minus S. It can be 0 or positive, or it can be negative. If it is 0 or positive, we have to draw it on the positive side of the graph. I'll tell you which is the positive side of the graph, which is the negative. And if this R minus S comes negative, we have to plot it on the negative side of the graph. Okay. Now if you see this, here this is R, this is S, so R minus S is negative. So in this case, we have to draw it on the negative side of the graph. Here it is R and S both are equal, so R minus S is 0. And in 0 we have to draw it on the positive side of the graph. So if we will calculate R minus S, if it is 0 or positive, we have to draw it on the positive side of the graph. If it is negative, we have to draw it on the negative side of the graph. Okay, so after understanding this, so this is the very important thing that we understand. Now we will make three leads. We know this is the lead 1, this is lead 2, we have just studied, and this is lead AVF. This is the positive side of lead 1, this is the negative side of the lead 1. This is the positive side of lead 2, and this is the negative side of lead 2. Now in AVF there is a confusion. AVF towards the floor it is positive side, and upside it is negative side. So this is we have to understand. Now if we know these two things, we can calculate the axis of any of the question. See here in this lead, now okay, now in lead 1 this is R, this is R, and this is S, so R minus S is positive. Okay, so positive means we have to draw it here. Okay, in lead 2 this is R, this is S, both are equal 0, so we have to draw in lead 2 here, because I have told you that if it is positive we have to draw on the positive side. AVF, this is R, this is S, so R minus S is negative, so we have to draw it on the this part. Okay, now we know this angle is 60 degree and this angle is 90 degree. Now take vector. If we take resultant of this and this, it will be here and it will be 45 degree. Okay, and now if we take resultant, now these two vectors are lost. If we take resultant of this and this, so this is 45 degree, this is 60 degree, we know that the net will come closer to this vector. Why? Because it has more angle. So net will be here. Okay, understand this. This is mathematical thing. See, first I have taken the vectors of this and this, that will be this. So it is 45 degree from this baseline, and this angle is 60 degree, as we know that lead 2 makes 60 degree from the lead 1. Now, so now if we take resultant of this and this, it will come closer to 60 degree, not 45, because 60 degree is more than 45. So it will be here, and if the result, so the final resultant is in this direction, which is, and this zone we know is a normal axis. So this ECG shows normal axis. Okay, this ECG show normal axis. Okay, but now here is a very important point, that you have to understand. Now try to solve the same question with the help of two lead method. In two lead method we don't use lead 2. Okay, so here lead 1 r minus s was positive, so we'll draw r minus s positive here, and AVF r minus s was negative, so we'll plot here. So net resultant will be here. We'll say that this patient is having LAD. Okay, so we will make a diagnosis of LAD in this patient if we use two lead methods. That's why I'm saying whenever there is a diagnosis of LAD, don't use two lead method, because LAD are of two types. One is physiological LAD and other is pathological LAD. So you have to differentiate between them. So whenever you have LAD, for example, most of the people use two lead method. So whenever you use two lead method, you get a right axis deviation. There is no need to use three lead method. Whenever you get northwest axis or a normal axis, there is no need to use three lead method. But when you are getting left axis deviation, so always use a three lead method to confirm that whether it is a physiological left axis deviation or pathological axis deviation. For example, this is the case. In this, if you will use two lead method, you will say that this is a pathological left axis deviation. But once you will use a three lead method, you will come to know that no, this is not a pathological left axis deviation, it is a physiological left axis deviation. Okay, that's why I was telling you that this area is a gray zone. It contains LAD plus also normal axis. So nutshell, finally, whenever you have a left axis deviation, most of the people use two lead method. Whenever you are using two lead method, you get LAD, cross check it with the three lead method. And in all other case, that is right axis deviation, northwest axis deviation and normal axis deviation, you don't have to do cross checking with the three lead method. Okay. Okay. Now this was the first question. Now coming to the second question. Now this is R, this is S. So R minus S is so now we'll be doing this case. Now here lead 1, this is R, this is S, so R minus S is positive. Okay, here R minus S, R is this, S is this, so R minus S is negative. Here this is R, this is S, so R minus S is negative. Okay, so now if we make a graph like this is lead 1, this is AVF and this is lead 2. Okay, so lead 1 R minus S is positive, so this is in lead 2 R minus S is negative, so this is here, and in lead AVF R minus S is negative, so this is here. Okay, if we take these two vectors, the net will be this with 45 degree and 45 degree. Now if we take these two vectors, now this angle is 45 and this is 30 degree. So net will be towards this because 45 is more than, so net will be like this, and this is the direction of left axis deviation. So this patient will be having a left axis deviation, and this is pathological left axis deviation. Okay, so this is the way how you manage vector. Whenever two vectors are taken, the net vector will be towards that vector which has a more angle from the middle line. Okay, I'm again telling you, in this case, see, you made this and this. This is lead 1, this is lead 2, this is lead AVF. Positive point of AVF, positive of 2. So R lead R minus S is positive, so this is here. In lead 2 R minus S is negative, so it is here. And in AVF R minus S is negative, so it is here. So first so these are the three vectors whose resultant we have to find. So we have first taken these two. So its resultant is this. It will be 45 degree and 45 degree. Now this is left, so we'll take resultant of this and this. Now its direction from its angle from this is 45 and its angle is 30 degree. So the resultant will be more towards this. So it will be here. So it will be left axis deviation. Okay. So this is how you have to calculate through two lead ECG. Three lead method. So I have told you use three lead method. It is best. Okay. Now coming to this is R, this is S. So R minus S is negative. In lead 2, this is R, this is S. So R minus S is positive. In AVF, this is R, this is S. So R minus S is positive. Now if you want to, this is lead 1, lead 2 and AVF. So in lead 1 is negative, so it is like this. Lead 2 is positive, that is it is here, and lead AVF is also positive, this. Okay. So now again this is 90 degree, so it will be 45 degree and 45 degree, and this angle is 30 degree. So resultant of this two will be towards this. So it will be somewhere here. So it will be right axis deviation. Okay. So this is how you have to do. So how I have done? In lead 1 R minus S is negative, so I have drawn lead this R minus S negative. In lead 2 R minus S is positive, so I have drawn it here. And in AVF R minus S is positive, so I have drawn it here. So we have three vectors, 1, 2 and 3. So first we have taken the resultant of this and this vector, which is this 45 degree from here, 45 degree from here. So this vector is making 45 degree from the here, and this lead 2 is making 30 degree from this. Now we have just known that when two vectors are added, so the net vector will be towards that vector which has more angle. So the angle of this from this is 45 degree. So the net is this. So, and this area is of the right axis deviation. So this patient is suffering from the right axis deviation. Now coming to the lead 1, lead 2 and lead AVF. This is the last question. Now lead 1 here, R minus S. This is R is minus S here is negative. In lead 2 R minus S is negative, and in AVF R minus S is also negative. So if you see here, this is R, this is S, R minus S is negative. This is R, this is S, R minus S is negative. This is R, this is S, R minus S is negative. So if you see here, so all are negative. Lead 1, lead 2, lead AVF. So R in 1 it is negative, in lead 2 it is negative, and in lead AVF it is negative. So all are in the same quadrant, that means resultant will be in this quadrant. So what is this quadrant? This is north west axis or extreme axis. Okay, so this is a case of extreme axis. So what is the carrying home message? Carrying home message is that Carrying home method is that you should use two lead method. That is, draw two lead, that is 1 and AVF, and calculate through it. If you are getting right axis deviation, or normal axis, or northwest axis, then you don't need to use three lead method. But if you are getting left axis deviation, then you have to differentiate whether it is a pathological left axis deviation or physiological left axis deviation. Then you have to use the three lead method. That is my point. For example, if this is a case here, if you want to use three lead method, in two lead method, you have to use lead 1 and AVF. So lead 1 is negative, that means it is here. Lead AVF is negative, this is here, so net is here, that means this is a northwest axis. And if in two lead method you are getting a northwest axis, you don't need to use three lead method. But if it would have been a left axis deviation, then you have to confirm by three lead method that whether it is pathological or physiological. This is very important. Okay. Now coming to a question. Now try to solve this question. This is a very good question. Okay. Now first do this question with the two lead method. Okay. So we'll draw lead 1. This is lead 1 and this is lead AVF. Okay. Now in lead 1 we have seen this is R and this is S. So R minus S is positive, so it will be like this. Okay. In lead AVF, this is lead AVF. This is completely negative. R minus S is negative. So negative point is this. So this. So in this reason, we will say patient has left axis deviation. So now we have diagnosed this patient as a left axis deviation. And I have told you, whenever you are using two lead method, then before saying that the patient is left axis deviation, first you have to do three lead method. You have to use three lead method. Now, so we'll use three lead method here. For three lead method, we'll make this and also lead 2 here. This is lead 1 and AVF. Okay, so we have seen lead 1 is positive. So this is lead 1. Lead 2, always take from the PR interval. So what you are seeing, R is more than S, so R minus S is positive. So this is lead 2. Okay, lead AVF, it is negative R minus S, so this is like this. Now again, if we take these two vector, net will be this, that will be 45 degree. Now if we take these two vectors, this lead, that is lead 2, makes an angle of 60 degree. So the net of these two vector will be more towards this. So it will be here. So that is a normal axis. So now with the two lead method, you were giving diagnosis of LAD, but actually it is not an LAD, it is a physiological LAD or it is a normal axis. So this is a very important question for what I have been speaking for a lot of time, and you must be bored that while I'm continuously emphasizing on this topic. So just use two lead method, and when you get LAD, use three lead method to confirm. Okay, so this is so what is answer? This is a physiological LAD, or you can say there is a normal axis. Okay. Now coming to the next question. This is a very important question. This is actually ventricular tachycardia. When we will be reading ECG, we will come to know that we have to differentiate ventricular tachycardia from SVT, that is supraventricular tachycardia. And there are a lot of criteria. One criteria is that ventricular tachycardia has AV dissociation, it has capture beat, fusion beat. Ventricular tachycardia has a northwest axis. And there are certain other R by S criteria that we'll read. So one of the criteria is that ventricular tachycardia has a northwest axis or it has an extreme axis. Okay. So now we'll try to calculate the axis of this ECG. Now, first we will use a two lead method. So we will draw lead AVF and lead 1 AVF. Now in lead 1, this is PR interval, so R minus S is negative, so this is negative. And in lead AVF, see this is R minus S, there is no R, so R minus S is negative. So this is, so net is here. So this is northwest axis. And I told you that if in two lead method you are getting northwest axis, right axis deviation or normal axis, there is no need to confirm it by the three lead. So this patient has a northwest axis. So this will help you to differentiate ventricular tachycardia with the supraventricular tachycardia. So there is high possibility that this is a ventricular tachycardia because this patient has a northwest axis. Now this question, very good question. This is a very good question. Now see, here again we use two lead method. This is lead 1, this is AVF. Now in AVF we have seen there is no S wave. No S wave. So R minus S is almost 0. So it is like this, very small. And if we see AVF we have a small S wave, very small S wave. So R minus S is positive. Okay, so R minus S is somewhere here. So this R minus S in lead 1 is almost 0 and R minus S in lead AVF is here. So remember, whenever R minus S is 0 in lead 1 that and R minus S is positive in lead AVF, this is known as a vertical axis. Which axis? Vertical axis. This is known as vertical axis, and this axis is generally seen in cases of emphysema. Okay, so this is a case of vertical axis. You have to understand this and remember this. So whenever you have a, and this lead 1 mein, the QRS is called as the equiphasic QRS. Equiphasic QRS. So whenever, so what is this ECG all about? This ECG vertical axis is, in vertical axis in lead 1 you will have R minus S 0. That means there will be no S wave, only R wave will be present. This is called as equiphasic QRS, and in lead AVF there will be S wave very small, negligible to R wave, so R minus S will be positive. So this will be a vertical axis, and this is seen in cases of the emphysema. So this is the chest X-ray of this patient. Now this is a tubular heart, increased reticular pattern, diaphragm on the same side, diaphragm of same height. So this is the case of emphysema. So in emphysema you get what? You get a vertical axis. Now causes of the axis deviation. Once you have become expert in axis deviation. Now first we will understand the causes. Now first we will try to understand the causes of right axis deviation. Okay. See, heart is normally placed like this. Okay. If there will be anything that makes the heart move like this or like this, that will cause right axis deviation. Simple funda. So now whenever this is right ventricle, so whenever there will be right ventricle hypertrophy, the heart will be like this. So that will lead to right axis deviation. So first cause of right axis deviation is right ventricular hypertrophy. Second, whenever there is a very much strain on the right ventricle and it enlarges, like acute pulmonary embolism. Acute pulmonary embolism. What will happen? In acute pulmonary embolism, there will be right axis deviation. Now, coming to the heart. We know heart has two main important things. One is MI, second is AV blocks. Now, please understand, we have a right carotid artery, right coronary artery, left coronary artery. Left coronary artery then divided into left anterior descending and left circumflex. This right coronary artery supplied the right sided and the inferior portion of the heart. So if there is any clotting in this area, that is in the left circumflex artery, then it will cause lateral wall MI. So whenever there will be lateral wall MI, what will happen? There will be no depolarization of these area because blood is lost. So the net axis will shift towards this side. So in cases of lateral wall MI, you will have a right axis deviation. So in which MI you will have a right axis deviation? Lateral wall MI. Okay. And in block, please remember this formula PR interval. In posterior fascicular block, you have a right axis deviation that we will discuss in fascicular blocks. So in posterior fascicular block, we have right axis deviation. Now coming to the lungs, note, if this is a person and there is a massive left-sided pneumothorax, then it will shift the heart to right side, that will cause right axis deviation. Or if there is a COPD, so normally heart is like this, because of COPD lung will inflate and it will shift the lungs to the right side, that will cause right axis deviation. And also in thin patient there will be right axis deviation. So in pneumothorax, heart will be pushed towards right side. In emphysema, heart will be pushed to the right side because normally heart is like this, so it has to be pushed because both the lungs are expanding. The only way heart can accommodate itself is like this. Okay. So in lungs, we have to understand left-sided pneumothorax, then emphysema and thin person. Okay. Now very important, also remember some rare causes of extreme axis right axis deviation is hyperkalemia, because hyperkalemia is known to cause posterior fascicular block. So it can cause right axis deviation. Just we have studied that posterior fascicular block can cause right axis deviation. Also TCA block, tricyclic antidepressant, can block sodium channel and they can cause right axis deviation. Plus in dextrocardia, I have already told you anything that shifts the heart towards right side will cause right axis deviation. So if you understand this, then left axis deviation can very easily be understood by you. Now we have seen that right ventricular hypertrophy causes right axis deviation. So left ventricular hypertrophy will cause left axis deviation. Also understand, if this is your heart and you get a right bundle branch block, so this part will be activated by left side, so this will lead to a right axis deviation. Similarly, if there is a left bundle branch block, left side will be activated from the right side, so left bundle branch block will cause right axis deviation, right bundle branch block will cause a left axis deviation. So here right axis deviation will be seen in cases of left bundle branch block, because when left bundle branch block will be there, what happen? Heart will try to shift. So left axis, so in left bundle branch block, heart will be activated from this side, like this. So there will be what? There will be right axis deviation. So in left bundle branch block, there will be right axis deviation. And similarly, opposite is also true. Okay. So left axis deviation will see left ventricular hypertrophy and also left in right bundle branch block. In right bundle branch block, we have said that we'll get left axis deviation. Okay, now coming to the heart, which MI? Inferior wall MI. Inferior wall MI, because we have said that in lateral wall MI, what will happen? Lateral wall MI, there will be right axis deviation because left side will not be functioning, and in inferior wall MI, which is caused by the right coronary artery, there will be left axis deviation. Then block, we have understand PR, that is posterior fascicular block causes right axis deviation. So anterior fascicular block will cause the left axis deviation. Now coming to the lungs, if there is a massive right pneumothorax, will cause what? Will cause the heart to shift towards the left side, and that will cause left axis deviation. Also, thick patient, that is obese patient. Obese patients are known to cause the left axis deviation. Then we have already studied there is something which is called as physiological left axis deviation. So now finally the carry home message is used two lead method for calculating axis deviation, and it is more than, and when if it comes right axis deviation or northwest axis or normal axis, then it is, you don't have to go for the three lead method. But if it comes left axis deviation, then use three lead method to confirm whether it is a physiological LAD or a pathological LAD. Then once you make a diagnosis of LAD or RLAD, then go down through these differential diagnosis to confirm what is the cause. So now this was the second part. Now we'll reach in the will meet within 1 to 2 days the third part of the ECG.